Hello everyone, in this video we are going to discuss about orthostatic hypotension, also called as postural hypotension. So by definition, whenever there is drop in systolic blood pressure more than 20 or diastolic blood pressure of more than 10 millimeters of mercury within 3 minutes of standing, it is called as postural hypotension or orthostatic hypotension. So what happens when a person stands up? Soon after patient stands up, the gravity pulls the blood down towards the legs. So there will be pulling of the blood at the legs. So there will be decrease in the venous return to the heart. So decrease in the blood return to the heart will decrease the cardiac output. This decrease in the cardiac output normally will be sensed by the baroreceptors, and these activate the sympathetic nervous system, causing vasoconstriction and increase in the heart rate. So these are the compensatory mechanisms which maintains the blood pressure. What happens in this orthostatic hypotension is there is defective baroreceptor firing and activation of the sympathetic nervous system. This can be because of any autonomic nervous system diseases like any Parkinson's disease or any neuropathies caused by diabetes mellitus, decrease in the blood volume which is non-neurogenic, and medications which blocks the reflex. So coming to the pathogenesis, inadequate autonomic compensation causing inadequate decrease in the sympathetic tone, blood pools in the legs and decrease in the venous return causing decrease in the cardiac output, causing decrease in the blood pressure. So orthostatic hypotension, baroreceptor or autonomic failure causing no compensation and falling BP will be seen. The symptoms will be because of this drop in blood pressure. There is dizziness, lightheadedness, syncope, blurred vision and fatigue on standing. Common causes are volume depletion like dehydration and blood loss, autonomic dysfunction like diabetes and Parkinson's, drugs like antihypertensives and antidepressants, and prolonged bed rest. So there are two types of this orthostatic hypotension, that is neurogenic and non-neurogenic. In neurogenic type, there is autonomic failure because of this diabetes and Parkinson's all. And in non-neurogenic type, it is because of hypovolemia and medications. So diagnosis can be done by orthostatic blood pressure measurement. First we will measure the blood pressure in the supine position, and after 3 minutes of standing we will again measure the blood pressure. If there is drop more than 20 in systolic or more than 10 in diastolic, it is diagnosis. Then other test is tilt table test. This is already also used in diagnosing between neurogenic and non-neurogenic type, and also it diagnoses the vasovagal syncope. So what we do in this is, first we will strap the patient on the table and we will take the baseline vitals in the supine position, both blood pressure and the heart rate, and then we will tilt the table to 60 to 80 degrees and we will monitor the BP. If there is any drop in systolic blood pressure of more than 20 and diastolic more than 10, we will see whether if there is decrease in the BP only and heart rate is maintained. So that because heart rate is maintained because something like baroreceptors firing is present still, so autonomic nervous system is working, so it is non-neurogenic type. If the blood pressure is dropped and also there is no inappropriate rise in heart rate, that is there is still heart rate is not increased, so there is abnormal baroreceptor firing, abnormal autonomic nervous system, so it is neurogenic type. So after 3 minutes there is no change, but after 10 to 30 minutes up to 60 minutes we will measure. After prolonged tilt, if there is sudden decrease in the heart rate and sudden drop in blood pressure, it is vasovagal syncope. So the treatment is, we have to increase the patient's fluid and salt intake and maintain the blood volume, and compressions, stockings can be given, medications like Midodrine and fludrocortisone can be given, and we have to treat the underlying cause.